This is NDTV. And you're watching NDTV 24/7.
Hello and welcome to our special show, our call-in show on coronavirus. All your questions, doubts, anything you want to know about this infectious disease answered right here. And we'll have doctors taking all your questions. This morning we're joined by Dr. S.P. Sondhi, a senior physician and diabetologist, Omnibus Healthcare Centre in Meerut, and Dr. Arun Kochar, senior consultant, interventional cardiology, Fortis Hospital in Mohali. Thank you so much, doctors, for joining us this morning and taking out your time. And we're reaching a very crucial stage, I feel, in India right now. On one hand, we are in lockdown, phase 3, and we're seeing a lot of the restrictions being lifted. But every day, the number of cases are still going up. So clearly, it's something we're going to have to live with. And many of us, the elderly, the young, and those with certain conditions, will have to be a lot more careful. Dr. Sondhi, especially people suffering from diabetes.
Yes, you're absolutely right. We are in a very critical phase of this war with corona. And let's not undermine our successes till so far. I mean, we have been able to contain it to a large extent, and not only contain it, but we have been able to, bring up our resources. Whenever you go into a war, you need your arsenals ready. And in the last 6 weeks or so, we did very well on that account. Just look at the numbers. We were just not doing any tests when it started. Today we are doing 75,000 tests. We didn't have, we were not manufacturing any PPE. And you must remember that PPE are like bulletproof jackets for us in a war. And today we are producing almost like 2.5 lakh PPE every day. And you're right, diabetic patients are at a higher risk of complication when they get corona. So they got to be very, very careful. Their mortality is almost like about 10 times the mortality of a normal corona person. So they got to be very, very careful about this. Right.
I'd like to get in Dr. Kochar as well, because as people start moving around a lot more, those with hypertension, heart disease, we know need to still contain or at least not, go out in public as much. Already we know in places like Punjab, policemen who are over 50 years old or who have these sort of conditions are being told not to go out in, the frontline duty because you're more vulnerable and you have to take greater care.
Very true. I think it's very important that we segregate people who are at high risk. And people who are at high risk are those suffering from cardiovascular disease, who have had stroke, who had bypass surgery done, who are hypertensive, who have heart failure. And especially if these people are over 60 years of age, then probably they should stay home. They should not venture out unless it's absolutely necessary, and they should take extreme precaution.
All right, we have our first caller from Mumbai, Pankaj calling in. Go ahead with your question, Pankaj.
Yes, good morning.
Morning.
Can mental health disorders take the form of an epidemic during these times of COVID-19 pandemic?
All right, interesting question there. Yes, Dr. Sondhi?
I think we have come to a stage when we have to invoke resilience within us. Mental health is extremely important in the current phase in which we are undergoing. And we must remember the words of US President Franklin Roosevelt in 1933. He said, "We have nothing to fear but the fear itself." So I think the time has come when we have to eradicate this fear out of mind. We have to plunge in this war with a lot of positivity. Positivity is our placebo tablet. Right now, we don't have any drug for this disease. But we all know, as a scientific person, that in all clinical trials, placebo work as medicine. And many patients recover even on placebo. What is placebo? Placebo is positive thought generated good chemicals in you. So I think time has come.
But what would you recommend, doctor? How does one, maintain that positivity? There's a lot of anxiety, you have to admit. We've come after this very prolonged lockdown. A lot of people at home, all of us, the media, doctors, warning people about how they have to take care. So clearly a lot of anxiety and it can lead to a lot of stress.
Absolutely. And so I will suggest that don't watch too much of TV. Don't watch too much of negative news. Of course, you got to know what's going on. Of course, you got to follow all the precautions and everything. But in the meantime, please spend time on a journey to go within. If you can't go out, please go within. It's a beautiful time to start a journey within. Self introspection, self-realization, reading good books. It's a time to read good books. All of the doctors who have been very, very busy, they all keep telling me that this is a God-given time to them to enjoy time, quality time with their wife, children, their home, their plants, and so on and so forth. So I think the crux of the matter is get busy in doing things. Don't be idle at home.
All right.
Read books.
All right, Dr. Kochar, something you'd like to add? And, also as we were discussing earlier, it's a time when now slowly the restrictions are lifting and it is causing, again, a lot of stress for people.
I think we need to accept that this is going to stay with us, right? And it's going to stay for a very long time. And we need to make a conscious effort to create positivity. Now, it's easier said than done, but I believe it's very important that we eat right. We eat what is good for our body, and we do certain amount of exercise. We meditate, or we laugh a lot as much as possible, and sleep is also very important. So we always talk how to prevent corona or how to prevent COVID disease in us, but we never believe what we can do if we are having mild disease or we have suffered from it. So post-traumatic stress disorder is a definite condition, and it has been seen that it's going to affect majority of the people. The best treatment, as Dr. Sondhi has said, is perhaps be positive and accept the reality.
Right, this is something hopefully once in our lifetime that we're all going through this pandemic and this lockdown situation. We have a caller from Chennai, Natarajan. Go ahead with your question, Natarajan.
Good morning, doctors. See, the person who is having high eosinophils, they develop some mild sneezing, mild cold, and all those things you know very well. See, sometime back when I discussed with one of the doctors, he said that you should worry only when there is URI. Usually the URI gets developed only after LRI, isn't it? Can you just advise me how? I'm a medical college administrator. You can speak. Okay, thank you.
Right, Dr. Sondhi?
Yes, if I understood the question correctly, definitely in this weather, which is April around, there is a lot of allergens in the atmosphere. There are pollen grains. There are threshing season going on and all those. So a lot of allergic things we come across. Whether these allergic diseases makes you more prone to get coronavirus, we really don't know. But one thing we are sure that because coronavirus main gate of entry in a human being is through the lungs, yes, those patients who have chronic lung disease, they can get into complications.
All right. We have a caller from Jafrabad, SL Gehlot. Go ahead with your question.
Good morning, ma'am.
Morning.
My question is that my wife is working in a central school, and after this summer vacation, school will be opened. And during teaching, how they will maintain the social distancing among the students of the school. So my question is that how they will maintain the social distancing in the children.
Mr. Gehlot, I think we're still waiting to see, what schools will also decide. But yes, at some point they will have to open. And Dr. Kochar, as you were saying, this is something we'll have to live with and manage our lives now over the next couple of months till such a time there's some sort of, medicine or the vaccine is finally found.
So I believe it's important to practice social distancing in all activities that we do, even at home and even when we are outside, because at home you may get somebody, some help from outside, or you may get some grocery man coming to your home, or you get a courier. So it's very important to maintain social distancing. And the only way to that is, both the persons should be wearing masks It's now almost compulsory in most of the provinces that you have to wear a face mask. You kindly maintain a distance. Best is about 6 feet, but at the most 3 feet distance is to be maintained at all times. And if you have to take something from the other person, it's important that he keeps it and he goes away and then you pick it up. So these are the steps that are important for social distancing. And it's also advisable not to go to the crowded places. And at the workplace, I believe, as you said, schools are not going to open for quite some time. But even if they do, or even in the offices, it's the duty of the administrator to maintain a distance which is good and which is healthy in these corona times.
Right, this constant hand washing and wearing of masks is something that is now part and parcel of our new normal. We have a caller from Bengaluru. Sridhar, go ahead with your question.
Yeah, we have. I'm a jeweler. We have been asked to open from the past 3 days. We are doing it so. We are properly sanitizing. We are using air thermometers, and we are using masks. And if whoever is coming without mask, we are also providing that. We are taking all the precautionary measures. My question is, can we? My store is a big store. Can we use the air conditioner? Is air conditioner safe to use because it's a time of summer? It is very suffocating. Is it practical, or is it correct to do it?
All right. I do know that in Chennai, at least, Doctor, I just want to share with you that some of the shops, they're allowed to be open, but they're not allowed to actually run the air conditioner because this seems to be some sort of worry. Dr. Sondhi, if you can answer that question.
Yeah, because, if there is a closed space and there is air conditioning working, the same air is being recirculated again and again. And so if one patient comes with that virus and puts it into the air, this will be recirculated again and again. I think those air conditioners in which you can throw the air out, there are very few. They can be run, and even in hospitals, we advise at least 5 to 6 exchanges of air in a room in 12 hours. So it's a tricky thing.
All right, it is a tricky thing. So, and also we're told that, good ventilation is something that helps in case of the virus. So, it's something that I think everyone will have to figure out on their own. And I do know there's certain rules that have been put down in terms of running air conditioners and at what sort of temperature you should run it at. We have another caller from Nagpur, Amarjeet Singh. Go ahead with your question. Prashant Puchiye.
Good morning, madam.
Ji.
Ma'am, I want to know how much time it will take for India to develop a vaccine for COVID-19.
All right, well, that's the $1 million question, Dr. Kochar.
I think we must analyze that how a vaccine comes into play.
Yes.
Normally, it takes 5 years for a vaccine to come and be effective. So, if we believe that out of the blue in 6 months or in 5 months, we get a vaccine. There are stories that it's being tested in humans and we start believing that vaccine is coming in a few days. So if everything goes right, the best case scenario, I believe, would be a year or maybe a year and a half that we get a vaccine. And to get that vaccine for 7 billion people around the globe would again be a difficult task. And let me caution you, I don't want to be a pessimist, but a worst case scenario may be that we don't get a vaccine like we have for HIV or dengue. So it's a rapidly mutating strain. So unless we are able to contain the virus by early discovery of a vaccine, it might not come at all. So it's not that it's 100% that it will not be coming, but there is a faint doubt that it might not come. But even if it does come, I think a year would be the best case scenario when it will be effective and can be used globally.
All right, that's a very big reality check in a sense on all this talk of the vaccine. Dr. Sondhi, we do know that there's a race across the world to develop this vaccine. Human testing has begun in the UK, Germany, US, everywhere. They're racing against time to develop it. But until then, we will just, as you said, have to live with the disease. Would you like to add anything to this, questions about the vaccine?
Yeah, I could be a little more optimistic and say that you will get a vaccine in February or so. But, these are all my guesses, and anybody's guesses, because many vaccines are developed and they don't withstand the test of time and test of trial. The only thing I'll say is that we have been reduced to herd, and this word is used for animals, but we have realized now that we are one of the animals, and we have been reduced to herd. And unless we develop herd immunity, either by getting vaccine or about 60% of our patients getting the disease, and we get into this herd immunity. And when we get into this herd immunity, this epidemic will die off. But when are we, as we are getting into the herd immunity and as everybody is getting this disease, we must try to keep the fatality down, the death rate down. And so far, India has been among the lowest ones of 3%. Look at US, where it is almost like 6.5%. And so if we can prevent deaths, I will say, I remember the 19th century German philosopher Nietzsche, who said, what doesn't kill us make us stronger. So we may come out very strong out of this epidemic, in a very positive way.
All right, but the worry is, of course, the vulnerable people who are there in our herd, if we refer to ourselves, and until we get a vaccine, it's going to be very, very difficult. We have Indira calling in from Bengaluru. Go ahead with your question.
Good morning, doctor. My question is, with the onset of monsoon in June, there's likely an increase in the regular flu cases. Is it recommended to take flu shots to prevent normal flu cases, as people may not be able to differentiate between COVID and normal flu, and there may be increased pressure on the hospitals?
All right, Dr. Kochar?
I think it's very important, especially for the heart patients, to get flu shots. It's also important to get influenza vaccination done. So both of these are very, very important vaccination schedules that we must adhere to. People who are at high risk are over 50 years of age, or who are hypertensive, or who are suffering from cardiovascular disease. It's not that, flu leads to coronavirus, but flu leads to lowering down of your immunity.
Yes.
Your guard is lowered, and then corona finds it easy to access your lungs, and it may cause disease which we are so scared of. So it's very important that we get these shots done, and especially for the high-risk population, as I mentioned, are those who are suffering from cardiovascular disease, or who have suffered stroke, or who are hypertensive and diabetes.
Right. Dr. Sondhi, yes, you'd like to add something?
Yes, I was just saying that this is a practice which we have been following for the last about 10-15 years. And I will say that it has fallen to deaf ears. Not many patients agree to get it done. If I give you the statistics in Meerut, in last 2 months, about 13 people died of swine flu. And there is a vaccine for the swine flu. Only 9 people died about coronavirus so far. But not everyone gets the vaccine for that. So, yeah,
a very important point. Yes.
Yep.
All right, we have another caller, Venkat Raman, calling from Hyderabad. Go ahead with your question.
Good morning, Gargi. I think this is wonderful service by NDTV,
Thank you.
where we get to learn. My question is to Dr. S.P. Sondhi. Very good morning to you, sir. Diabetics, specifically those who are above 50 age group, it's advocated by many of you that vitamin D is the most important component one need to maintain a balance. Unfortunately or fortunately, even gated community or not gated communities, wherever we live, what are the precautions that diabetics need to do when he goes out and takes the sun bath and comes back? And what kind of a food you will advocate? I mean, specifically that what are the things one should be extremely careful about?
Okay, so one thing is definitely that diabetes is, if he gets COVID disease, he is more likely to get into complication. It is not that diabetics are more prone to get the disease. No, they are as prone as their counterparts of the same age group. But if they get the disease, they get it more frequently into complication. One thing they can easily do, and that will help them a lot, is to control their diabetic status very well during this period, because this is a fact that if the diabetes is out of control, you are likely to fall into more complication. And the relationship with the COVID is is, two ways. Not only diabetes makes you more prone to COVID complications, but COVID increases your diabetes. So, it's a two-way kind of street. Yes, and when you talked about vitamin D, there are a few studies which say that, vitamin D is good even for preventing COVID or something, but these are all just experimental studies. There are no recommendation. Yes, vitamin D is important for our health, not only for our bone health, but many other things. Most of the time we don't get it while sunbathing or anything. In any case, the sun is very strong as far as India is concerned, and so we cover most of our body. So, you got to ultimately take, in a study done in AIMS, it was found out that 90% of doctors and paramedics are deficient in vitamin D. So we are ubiquitously deficient in vitamin D. We can take tablets. And as far as diet is concerned, I think diet which controls the sugar well, diet which contains enough of proteins, diet which contains some amount of vitamin C, and so on and so forth.
All right, and of course, try and get your exercise as much as you can during this time, even during lockdown. We have our last caller, Shobna, calling in from Coimbatore. Go ahead with your question.
Hi, Gargi. My question is, see, we are looking at a vaccine to treat this ailment. So this is during a particular epidemic. With the idea of people wanting to get back to work, get back to their normalcy, is there some virus repellent, something we can hope for, like a spray or something that will, do away with this, allow this virus to not to come to us?
All right, Dr. Kochar, so that again, the question around how do we get back to normal in this situation without the vaccine, without any cure?
Well, I'll say a new normal should be adopted, and new normal is going to stay for long. Please don't be so afraid. I believe if you're talking to somebody and both of you are maintaining social distance, both of you are wearing masks, both of you are practicing hand hygiene, then I believe nothing to be afraid of. But unfortunately, we do not have a magic bullet. We do not have a magic spray that can, go make corona go away. Much that we like to, but unfortunately, at the moment, we have to rely on the standard recommendations, and we have to believe that vaccine is around the corner. Maybe March or maybe April, we might have a vaccine. And earlier than that, we might have monoclonal antibodies coming. That's a recent Italian and Israeli researchers have found out that. And that is a real breakthrough if it happens. And that is going to save a lot of lives, and that might let this pandemic go away earlier than we thought.
All right. Well, I'm completely out of time. Thank you so much. And thank you, Dr. Kochar, for ending on that optimistic note now. So, Dr. Kochar, Dr. Sondhi, thank you for taking out your time and answering all those questions. Time for us to slip into a short break. We'll return with more.